Imazio has to leave early. So Dr. Massimo Imazio from Italy will present the COlchicine for prevention of the post-pericardiotomy syndrome and post-operative atrial fibrillation, the COPS-2 trial.
Thank you very much. And I'm very pleased to present briefly the results of the COlchicine for the prevention of the post-pericardiotomy syndrome and post-operative atrial fibrillation trial. This is an independent study, a spontaneous study within the Italian national healthcare system, and we obtained institutional grant essentially as drug and placebo from Carpia and supports for insurance costs from Fagim, but both the companies had no role in the planning of the study, in the analysis of the data, or writing the manuscript. And so I will speak about an unlabeled use of COlchicine for the prevention of the post-pericardiotomy syndrome and post-operative atrial fibrillation. The background of the study, the COPS-2, is the COP1, because this trial has been presented in 2010 in Stockholm in a hotline session, and the post-operative use of COlchicine, starting from post-operative day 3, was associated with a significant reduction of different post-operative complications, including the post-pericardiotomy syndrome, post-operative atrial fibrillation, post-operative pericardial and pleural effusion, with an impressive relative risk reduction from 40 to 50%. So very impressive result, even when the drug was given after the cardiac operation, starting from post-operative day 3. So considering that most of the events were recorded in the COPS trial in the first 60 days, and all events were recorded in the 3 months, we considered that probably a shorter follow-up, such as 3 months, as you will see in the COPS-2, would be sufficient to detect the effect of the drug. The second point is that, as you know, if we consider the post-operative atrial fibrillation incidence, we can see that in the first 3 days, we have the greater incidence of this complication. So the idea was that probably giving COlchicine before cardiac surgery instead of after could probably improve the efficacy of the drug. So we had to pre-treat the patient 2 to 3 days before cardiac surgery in order to have probably a greater efficacy of the drug. And that's why we did the trial, to determine the efficacy and safety of perioperative administration of oral COlchicine to reduce the post-pericardiotomy syndrome, post-operative atrial fibrillation, and post-operative effusion, pleural and all pericardial. So the study hypothesis was that COlchicine could have the incidence of the post-pericardiotomy syndrome and probably have a similar effect also for post-operative atrial fibrillation. So the study was powered to test this hypothesis, including 360 patients, 180 patients on placebo and 180 patients on COlchicine. We avoided the loading dose in order to improve the patient compliance and used weight-adjusted doses, that is 0.5 milligram twice daily or 0.5 milligram once daily if the patient was less than 70 kilograms, from 2 to 3 days before surgery till 1 month after surgery. And the primary outcome was the incidence of the post-pericardiotomy syndrome. Here the results, balanced baseline features. COlchicine was able to reduce the incidence of the post-pericardiotomy syndrome with an absolute difference of 10%, but in the intention to treat analysis, we did not reach a significant difference in the incidence of the post-operative atrial fibrillation. On the pre-specified on-treatment analysis, that is including only patients who tolerated the treatment, we can see that the drug was efficacious to reduce the incidence of the post-operative atrial fibrillation. No effects on post-operative effusion, and no other effects, significant effects, difference in other outcomes. So the main concern is the safety, because we did not record serious adverse events, important point, no fatal or life-threatening events, but we recorded more adverse events, especially gastrointestinal intolerance, especially diarrhea, in the COlchicine group, in 20%, compared with only 11 or 12% in the placebo group. And that's why probably the drug was not so efficacious for the prevention of the post-operative atrial fibrillation in this trial. So let me conclude that among patients undergoing cardiac surgery, The perioperative use of colchicine compared with placebo reduced the incidence of post-pericardiotomy syndrome, but not of post-operative atrial fibrillation or post-operative effusion. The increased risk of gastrointestinal adverse effects reduced the potential benefit of colchicine in this setting. And you have to consider that in the perioperative period, patients usually take other drugs such as proton pump inhibitors and antibiotics that may also be responsible of gastrointestinal intolerance. So a combination of different drugs with these potential side effects may lead at the end really to the side effects itself. And the paper is published today on the Journal of the American Medical Association. Thank you very much for your attention.
Thank you. This paper, which addresses a very important clinical problem of inflammatory complications after open heart surgery, is now open. And please identify yourself. Yes.
Hi, Christina Fiore with MedPage Today. How will you use colchicine in practice now based on the 2 studies that you've done?
Okay, we observed that colchicine confirmed its efficacy to prevent the post-pericardiotomy syndrome, but looking at the patient population and the events, the prognosis and the outcome of the patient who had the post-pericardiotomy syndrome was not so worse. So considering the side effects, I think that probably is better to treat instead of prevent this complication. That is, the COPS trial showed that you can use the drug after surgery with good results, and we have good evidence coming from several trials on pericarditis that early treatment can be useful to prevent recurrences. So probably it is better to treat than to prevent in this case. Or maybe there are a couple of trials ongoing in the US on this use. We have to see if lower doses, only 0.5 or 0.6 milligram once daily, may be better and may be better tolerated by the patients. Thank you for the question.
Could I just clarify something? In Europe, you have still a generic colchicine, because in the US we only have an expensive branded version. Is that true?
Well, in Europe,
you have a
in Italy,
generic?
we have a branded colchicine from Acarpia, and I guess it is also distributed in most of European countries.
You also have
in
generic?
In Italy, we use this one.
Oh, but you have generics here.
It is not a generic drug. It is, I don't know, it is a branded, but I don't know if there are differences between different type of drugs.
Additional questions? Thank you very much. We'll go on to the next.
Okay, the next presenter would be Professor Fayez Sanab from the Centre d'Investigation Clinique de Nancy in France.